Dr. Shannon, thanks for being here.
Yeah, thank you for having me, Eric.
It's awesome. And before we begin, we're in the era of the pandemic, or the pandemic era, I guess I should say. So how are you doing?
I'm good. I've mostly been, with extra time on my hands that I used to spend working a lot. I've mostly been catching up on all the sleep I haven't had for 20 years. My dogs are very, very well walked and happy, and I've been knitting lots of things for people that they will probably never wear. How about you?
I don't know if I can top that.
Would you like a scarf, some mittens?
That's actually pretty good. Well, you can articulate that. I always go, people will ask you, especially once, in the period that we're opened up, you see people you haven't seen in a while. What you been doing?
Yeah.
I go, I don't know.
Right.
Because every day seems to be different. And you were deemed essential, naturally, the whole medical community.
Yes.
Is that correct?
Yes.
Talk a little bit about the experience.
Sure. So I think we first started to really pay attention to what was going on with this I remember it being the week before the St. Patrick's Day parade when they were talking about closing that down. I was thinking,
yes,
that's crazy. Like, nobody's going to shut down Pittsburgh's St. Patrick's Day parade.
I remember.
And so that was, and the weekend before that, I think, was the last time I was at a bigger party. I was at a house party for somebody's birthday.
Okay.
And so it was an interesting thing because I think the governor did the stay-at-home order on the Friday, and we weren't sure at that time whether we were going to be allowed to be open or not, because they had said basically everything was going to close.
Okay.
And then we were like, oh, what do we do? And I remember sitting in the room with my staff and saying, I think we're done until they tell us to come back. And then they amended it with the grid of essential workers. So we were deemed essential healthcare, but they put down a lot of stipulations, only emergency, only acute treatment, no routine visits.
Okay.
And so, but with no definition of what is that and what does that mean? So we had to it was a combination of us both selectively telling patients, you're typically a wellness patient, you should wait until next month or whenever this changes, and our own patients self-selecting whether they wanted to come in for treatment or not. So that first week, I think we saw 80% of our patients cancel their visits. So our normally, really busy clinic was very, very quiet. Right. So in that first week, we had to make the decisions of do we stay open? Do we stay open all of these hours? Do we keep our staff? Do we lay our staff off? What do we do? So we ended up doing almost like a hybrid sort of thing where we laid off probably more than half of our staff.
Okay.
We kept, myself and my partner, who's also a chiropractor, 2 administrative staff, our nurse practitioner, and our medical director. And then we consolidated our schedule. So we went from being a 6-day-a-week practice to 3 days, 9 to 5. And then we had to put protocols in place for cleaning, spacing patient visits, all of that stuff. So it was funny because we were working less hours-wise and effort-wise, but it was so incredibly exhausting because you didn't know, and you're watching the numbers and, you're calling patients are you keeping your appointment or not keeping your appointment? And, having to help people emotionally deal with where they were in that space. And so that continued for a period of time. And then when we went to yellow, I believe it was somewhere around May 1st, that's when people really started to be a little bit more brave about coming out and, getting back on track and things like that. And since then, it's kind of been the same. Green changed a little bit more, but I think people are still, even last week we had clients where my one client, I love her so much. I'd missed her. She is normally a wellness client. She hadn't been out for months and months. And she said, today is my danger day. Her doctor actually said to her, you need to go out every once in a while. You should probably go to a store or go get a coffee somewhere or go whatever. So she decided to come and get her adjustment, which was really cool. But, nonetheless, probably really nerve-wracking for her, to say the least. So it's just been interesting. We've just tried to be incredibly kind to our patients. The people that are there are very happy to be there. They're patient. They're nice to each other. They're nice to our staff team. So everybody's in a place where they're very kind and warm, which is nice. But we're just trying to navigate it so people feel, safe and can do what they need to do to stay healthy.
It's, to me, doubly difficult for the medical community in that there's 2 things you need to address during this pandemic. One is you got to keep the doors open.
Absolutely.
There's absolutely a business component, which cannot be lost in the shuffle here. And at the same time, you have that responsibility to your patients to do what you can based upon what you're permitted to do, right?
Yeah, absolutely. And I think one of the things that was interesting to me when all of this was playing out, the hospitals, thank God, like their censuses were low and they weren't inundated the way that they expected to be. Nurses were cleaning instead of seeing patients and, starting to talk about layoffs and things like that. So one of the things that I really appreciated, I feel like UPMC, whoever their spokesperson is, has been the voice of like moderation in all of this, because they basically came out and said, like, we are going back to doing elective procedures. There are people that are waiting for things.
Right.
There are people that, obviously, like, we can handle this. Like, let's start to get back to normal. And they kind of forced their hand a little bit in that. But I was appreciative of that because I feel like that needed to happen. I mean, how long are you going to stall, the healthcare model and let that affect both patients who are suffering and the hospitals and the workers and all the other people that trickles down to. So I was happy when they did that. I was like, yes, and I think that sort of opened the doorway a little bit for people to be able to do more of the things that they need to do.
For the record, to my understanding, and I'm assuming it's your understanding as well too, we were not inundated anywhere near the calamity that's the larger cities of Miami, New York, Los Angeles they faced in terms of the immediacy of those seeking treatment. Is that correct?
To my understanding. So
okay.
I can't claim any knowledge personally aside from what I've been able to get from the news and from, family members who work in the healthcare model or friends or clients. No, and that's a good thing, right? Because they were so worried that, you saw the horror of what happened in the cities where it was fast and unpredictable. So I think that we were very well prepared. I mean, I think Pittsburgh was incredibly well prepared to handle whatever was going to happen. And I feel like we had the good luck or preparation to not have to act on it that way. Not to say that we're in the clear. I mean, they're talking about it now. And I think people, because we don't know exactly what this does or how it works, and that information changes all the time, I think that people are still, being very cautious, which is smart. Because, if you're not, and then you see that spike, shame on you for taking all these preparations and then just throwing them away. So I think it's like you have to just really sort of be observant and watch what happens.
Society, in the modern society, we've never encountered anything like this. Would you agree? I mean, we've had calamities and we've had crises and so forth, but nothing like this.
No, I don't think, and that's why I think that everybody's confused. I mean, you see, when you talk about crises and calamities, I mean, we've seen wars, we've seen really bad accidents, we've seen
terrorism.
Yeah, exactly. And, but yeah, this isn't that. And because it's so insidious, you can't see it, you don't know. Sometimes it acts like this and sometimes it acts like that. I think it's like the extra big boogeyman for people because we've never encountered it and they don't know what to expect. You can't take a picture of it and invisible. Like see it. Yeah, kind of. It's just there.
Yeah, one thing for me, it exposed the fact that we did not have a plan. That there might have been teams of people in high places that may have thought about this scenario over the course of years, but I don't think we ever allotted the amount of funds for it, or we never really put a plan in place to deal with it.
Yeah,
it seems like it was hodgepodged a lot too.
Well, I think they have to. I mean, I would never want the job of any of our politicians right now or ever. I mean, even outside of this, I would never want that job because it's terrible scrutiny and just all the stuff that comes along with it. Yeah. I don't think they know. It's like you can't know. And then depending on, once again, we were talking about a little bit earlier, people's worldview, right? Like we all live in the same world. We all live in the same space. Right. We're on, I read a book once where they said it's like, pretend it's a beach ball, but everybody's standing on a different stripe. It looks different. Right. So depending on what they're seeing, what their advisors are saying, what their constituents are saying, their policy has to be flexible. I think they almost have to be given the grace of making a mistake and correcting for it as they go. I mean, the amount of agility that we're requiring from everybody right now is a lot.
Okay.
Yeah.
Let's turn the conversation, if we can, to chiropractic.
Sure.
I have so many questions. And,
I love chiropractic
I know
questions.
You do. I know you do. And thank you. Thank you for agreeing to do this.
Sure.
Before we get into chiropractic, tell me a little bit about your background. Like what led you to medicine in this specific discipline of medicine?
Oh, it's actually a funny story. I'll try to keep it short, but it was.
We have time.
Okay.
That's what we do here.
Well, it was purely an accident. I mean, honestly, it was purely an accident. So, my mom is a nurse, so we grew up, watching her go to nursing school and coloring in her anatomy coloring books, and she would practice her clinical stuff on us against our will. We were always like, we don't want to be your patient. My poor mom. Anyway, but I did not really have an interest in science at all, and I went to college originally because I thought I wanted to teach home ec.
Okay.
You can see the correlation there. It's very direct. It's not,
no, I don't see anything.
No.
I got the joke. I got it. Yeah.
But it's true. I mean, it's literally true. Okay. So, but it was funny because when I went away to college, my brain, I feel like my brain had the freedom to start to work differently. Okay. And I really got into like achieving things, right? So I loved like crushing tests and getting good grades, and I don't know, something happened. So, I realized I was really good at science and I could do math and whatever. So I decided I didn't want to be a nurse because I don't take orders well, but I should be a doctor because then I could help people and it would be really cool. So, and actually one of my really good girlfriends who I still run with, we were sitting in the living room one day and she's like, "You're so smart. You should be a doctor." And I was like, "You're right." we may or may not have been inebriated. So, but it was good advice, and I am now. But it was funny. So I went to Pitt and I changed schools, declared a pre-med major, and at that point in time, I was fortunate enough to get a job at a physician's office, and he was retiring and another physician was buying his practice, and they needed somebody to like pull files and fill out like the little HCFA forms and spin blood in a centrifuge. So I did that. And when I was doing that, like what I really got to observe was there were a lot of people with a lot of problems who were taking a lot of medicines and continuing to take medicines, and they weren't feeling any better, but nobody was like telling them like how to do lifestyle changes to get better. You know what I mean? And it was like the science had just come out. Like if you have somebody with diabetes or high blood pressure and you can get them to lose 10% of their body weight, chances are their diabetes and high blood pressure will calm down. And and it was also the time when like you saw all these continuity drugs, which a continuity drug is a medication that the patient like basically take it and stay on it until you're dead. Yeah. And I had this philosophical issue with it where I was like, I don't want to do this to people. Do you know, like I don't want to write prescriptions all day. I don't want to give them chemicals all day. But at the same time, if you're a physician and if you're that kind of physician and you're not doing that and one of your patients dies or has problems.
Liability issue. Correct.
Yeah. And I was like, oh, this is bad. So like I couldn't philosophically practice the way that I'd probably want to without getting in trouble. So I was like, I didn't know what to do. And my advisor at the time, I don't remember her name. She was a graduate student in German, was like, you should be a chiropractor. They don't do drugs. And I thought, I grew up down the street from a chiropractor who shared space with a podiatrist. So all I would see was like old people, and I knew what a podiatrist was. So I'm like, if it's about old people feet, I'm not doing that. Although I do touch a lot of old people feet now because I adjust patients' full body. But anyway, so I read a book about it because this is pre-internet, and I fell in love with the philosophy of chiropractic, which is that the body is really smart and that it knows how to run itself and it knows how to heal itself, and it will do that within the limits of time and tissue, meaning like aging and all that other stuff that affects us. But your body is always trying as hard as it can to bring itself to a state of homeostasis where it's well balanced. And it had a healthy respect for that. So I went to school and I thought it was the weirdest thing ever. I mean, when you go to chiropractic school, at least the school that I was at, and thank goodness it was like this, because I think to really grasp the concept of chiropractic, you have to be like fully inundated in the philosophy, which, is like drugless, non-surgical, giving the body time to heal itself. The nervous system controls everything, because the doctors who are the best chiropractors and are the ones who have the best practices with the patients that are really like get the big idea of like my body is awesome and they'll take really good care of it, are those that are really philosophically based. Okay. So, you learn science and you go through the whole entire thing, and but I just fell in love with it, and I came out of school and back to Pittsburgh to practice. And when you're a new doctor, you technically know what to do, but you haven't really seen it like work yet. And so whenever patients, come to you and they're not feeling well, or I remember the first baby that I adjusted in real life was like an 8-month-old that was getting these acute asthma attacks, and they stopped, which we know that the adjustment has an influence on the histamine systems in the lungs. And I was like, oh my God, it works, and to this day, like I
validity,
still,
right?
Yeah, and it's interesting because there's a lot of science behind it, which a lot of people will poo-poo, but I mean it's been a healing art since ancient times.
Right.
The art of bone setting, and I tell my patients all the time. I mean, in caveman times, there are cave paintings in France that show people adjusting each other for the purpose of healing. So since the beginning of time, if you had something in your body that was stuck in a place and it made you feel sick, having somebody put it back into place and you feel better made sense. It was logical. Something isn't where it belongs. It's making me not be able to work the right way. Put it back where it belongs. The body will work the right way. That makes complete sense. Only in the 1900s, with the advent of pharmaceuticals and the marketing of pharmaceuticals, and mind you, there's a place for that, and we actually have medical physicians in our practice now. But at that point in time, us, started to lose their logic, and we were instead taught to have symptom control. Like, oh, like my back hurts, something feels stiff, I'm going to take a pill so I don't feel it.
When did that happen? Do you have a rough idea of when you think that happened?
No, I mean, I think, you had the advent of different medications have been around since, whatever. You can talk about the invention of aspirin and penicillin and all these things that changed lives. But I mean, you had herbalists, and then you'd have, I think probably the early 1900s, and when you could actually manufacture things and distribute things. And then, with the AMA and their big, you had a big political fight with the AMA and chiropractors that started in like the 1920s and osteopaths. Right. But I just think that, in many respects, the pharmaceutical community, they have really good products.
Okay.
And they work for symptom control, and that's humane. But over time, like that, more and more marketing and people bought into it. And so now we have a lot of people taking a lot of medications. I think in the US, they say we consume half of all the medications manufactured in the world, but our longevity is only like 34th.
Right.
So we're taking tons of drugs and we're living a long time, but not necessarily well.
The quality of the years.
Yeah.
Would you say, is the word dependency too strong of a word to use? Because I've got family members aged that I've watched over the years. I'll share this. My father, who we just recently lost him, but for most of his life, that's not true, most of his adult life, he has a litany of medications. And I can remember visiting him 10 years ago, and they were all on the kitchen table, and I just could not believe just the volume of what he was on and the different medications. And it was frightening for someone that really just was coming from the outside looking in on that. I was frightened.
Yeah.
But you assume, they're being medicated obviously by physicians. And I don't know, it just seemed like a lot. It seemed like a lot to me.
It is a lot. And they talk about, you can read the statistics on how many, the more medications you take, the more likelihood of side effects, and polypharmaca, which is like the mixing of multiple medications, especially in older patients, is a real problem.
Yeah.
Physicians aren't unaware of it. A lot of times people will say, oh, my doctor just wants to give me drugs. And I'm like, no, they don't.
Right.
They really don't want to at all, but they are educated to do so, because if they don't, this could turn into XYZ and, that sort of thing. So, it's a touchy conversation, because would we say dependency? Well, not necessarily, but I would say that there are a lot of things that people don't want to do, but they're afraid to not do.
Okay.
I see it a lot with patients with statins where their cholesterol's high. And they're like, I don't want to take it, or I've had these bad reactions, and, my muscles hurt, and, they change drugs, but they're afraid to not take it because they're afraid that if they don't, then their cholesterol is going to spike and they're going to have a heart attack. So it's, sometimes it's purely the fear of what happens if I don't, or even when people are deciding whether or not to have a flu shot, if I don't, I'm going to get the flu and die, or if I don't get my shingle shot, it's like there's a lot of fear in what happens if I don't.
Okay.
And I don't know, I don't know the true stat of what happens if you don't, or if you do, I can't speak to it because it's such a variable thing from one person to another. But I think that in many respects, people find it difficult. Like a lot of our health could change with lifestyle changes, but they're so hard. I've been that person, whether it's losing weight or stopping a bad habit, changing lifestyle factors is hard. I also think that, nutritionally, it's almost impossible to eat healthy because we have all this stuff, so it's a complicated thing. So do people become medication dependent? In some respects, I think yes. Is it because they have to be? Maybe, but
is it more psychological overall? Would you say it's more psychological? If the word dependency is end up being correct, is it more psychological dependency as opposed to, I don't know, physical dependency?
Well, yeah. I mean, I think that people are afraid to not do medicines.
Okay.
Especially if their numbers. I mean, we treat patients according to numbers a lot, you know, and you know, and speaking about the statins, we saw the thing, like that's a big thing for me because we saw, you know, the cholesterol originally was allowed to be this, and then it was, you know, it was lobbied. So now cholesterol is really supposed to be this. So if you were over 200, then you were, you know, high and you had to have a medication. And now what I was seeing, although I haven't seen it recently, like for about a year, was where patients would be like their total cholesterol was fine, but their bad cholesterol was high. So they would still be prescribed a medication to get that one down.
Mm-hmm.
And then in light of that, now you have, you know, all these problems with like, you hear about the clinics with like low T and all that other stuff for testosterone.
Mm-hmm.
I mean, cholesterol is where we synthesize our sex hormones.
Right.
So,
Right.
you know, are we dropping it to a point where now we have this whole other second
You're
disorder?
creating an issue, right?
Yeah.
Right.
So I don't know. I think that if people, one of the really good things you could do, actually, this just came to mind. I know several pharmacists who work as entrepreneurs, and one of the things that they would do is do a complete medication review with patients and look to see if they had like crossover, like, or, you know, review their records and things like that, and actually
It's a great
interact
idea.
with the patient's physician. Yeah, to do an independent review of all the medications.
Especially our
their
elderly,
interactions.
wouldn't you agree?
Yeah, for sure.
Yeah, that's a huge concern. Some areas to go with this. Talk a bit about the concept of holistic medicine.
Okay.
I know it's a deviate, but would holistic medicine or would chiropractic be part of holistic medicine or not?
Yeah, I mean, so the whole concept of holistic means just looking at the patient as a whole human being
Okay.
versus pieces
Okay.
of the person.
Okay.
So, you know, there are lots of holistic practitioners, right? A massage therapist is a holistic practitioner.
Well, the
because-
name gets poo-pooed, I think, a lot by certain, I don't know, certain concerns in the medical community. At
Yeah.
least to me, the impression has been.
Yeah, well, I think that it's because when we think of holistic, we think of somebody like dancing around, like shaking herbs and feathers over their patient and like playing raindrop music or something. You know, it's like this weird like witch doctor thing.
Yeah.
But I mean, even a general practitioner is holistic. Like your GP has to be holistic. They're trained on all the systems of your body, and they have to be your first line of
Right.
defense
Right.
when you're dealing with a health concern. So, you know, chiropractors, yes, we're holistic because we look at the whole human, but how people treat the whole human is where you sort of get into those variances.
Okay.
So holistic medicine is thought to be things that aren't medications, right? So you can look at homeopathy and they say it's holistic, or nutrition can be holistic, or functional medicine, which is a whole branch of medicine based on like getting the body to function the way that it's supposed to.
Okay.
Is holistic. Chiropractic is holistic because you look at the way that the parts are all integrated together through the nervous system. So if you truly look at the definition of holism, it's much more common than you would think. Where we see less holism is when somebody specializes in an area. Like you go to the orthopedic, you have a shoulder problem, you're going to see the shoulder guy. That's not holistic.
Okay. That's specific.
It's specific.
Right,
Yeah.
right.
Your liver's not doing what it's supposed to do. You're
Right.
going to go see the hepatic specialist.
Okay.
And of course, like your liver has a role in hitting all your other systems and how your body functions. So even that person is holistic.
Is there more of a trend to treat, well, it appears to me that there's more of a trend to treat the entire person today than there may have been 20, 30 years ago.
Absolutely.
Okay.
Absolutely. I think that you and I are, you know, of the first generation, speaking of the experience that you had with your dad, I think the generation in front of us was less willing to ask questions of their doctor
No
and less
question.
willing to like push back,
No question.
whatever. And it was more like,
question.
it was like almost like an obedience thing. And they talk about like the church of the white coat, you know, and like that sort of thing.
Right.
But I think that, you know, we have been exposed to enough now where, you know, back in the 70s, yoga was weird, right? And it was what cults did to influence you.
When I was a child, that's how it was presented to me.
Yeah. Ooh, you know. And now it's like, it's everything, right? Like
Right.
everybody does it.
Right.
So I think that our generation is the first generation. And I would say like, well, probably, yeah, Gen X probably is the first generation to really like push into this field
Okay.
of like, wanting to be holistic.
You maybe give me the benefit of the doubt on the age thing.
Are you a boomer at the end of the boomers?
I don't know where the cutoff is.
Xers?
I'm 54, so I was born in 66.
Yeah, so you're the same as my husband.
Okay.
And I think that you guys are like, we were having this conversation about a boomer and an Xer because he wanted to save the manual for the stove and I wanted to throw it away. Or no, the refrigerator. And I was like, just throw it out.
I would have tossed it, so I'm on that side.
Then you're an Xer, I think. But I think that's, you guys are in like that gray area. But right. I do think so. Like, I think what we see is we want to live a long time.
Yeah.
People don't expect to get old, right? So you're a much younger 54-year-old than your dad was probably.
I think so.
Yeah. Well, and that's, I mean, even in our practice now, like we do regenerative medicine, which is the whole science of like making your body restore itself. So
we'll get there.
Yeah. Well, I love that stuff, but it's like, you know, and people don't necessarily like, we don't want to look like Cher with all the plastic surgery, but we want to like look good, feel good, be able to do the things that we want to do, enjoy our lives and our retirement. So I think that we are, and we've seen people who've gone down the route of carrying around a Ziploc full of drugs and having a million surgeries and just poor quality of life and just this degradation. So whether we approach it from, you know, I think we approach things much more preventatively than we used to in the past. I think that people now, what I've seen in the past 20 years in my practice is that people now are much more aware of their own responsibility in their health. Like they'll get it where they're like, I'm not doing what I need to do. And so I'm like, yes.
That's positive.
Yeah,
positive.
It really is. I mean, I started my practice in 1999, and I've seen a much bigger like movement towards people trying different things. People will ask about acupuncture and they'll do different diets or they'll supplement a little bit more. And they're just much more aware of the fact that like they have some effect in how things play out. So they want to do that. I mean, they want to be well. So not everybody is like that, but I definitely see more people being serious about that.
As a consumer, it's tough. It's really tough. Without having a medical background, you have to see it. I mean, you're probably confronted with new diets. You probably hear of a new diet every week from a different patient, right?
Right. Yeah.
And so it's tough to maneuver as a consumer out there. Wouldn't you agree?
Yeah, absolutely. But I tell people all the time, I mean, you have to think of the things like, I'm a huge moderation person. Like I do everything in moderation, because if you say, you know, when Atkins was a thing, like I'm going to do Atkins, well, cool, you're going to do it for whatever, but someday you're going to want bread. Sorry. Or like, you know,
fall off the wagon and you just stay off the wagon.
Yeah. Or ketos or, you know, whatever. So I think that like, you know, I tell people all the time, like you have to think about like, we're all different, you know. And actually my brother, before we were talking about him doing real estate, he did nutritional counseling.
Okay.
One of the things that he was really good about was figuring out for each patient, like what their particular poison was. And we all have it, you know what I mean? So for some people it's like, you know, I can't stop eating XYZ. Other people, it might be that like they still smoke. Other people, it might be that they have, you know, really bad sleep habits, you know, so everybody's got their own thing. And for some people, some things are really easy to change. You know, I say like, if you look at all the stuff that you're doing, like you make choices every day. You're either going to push yourself further into the positive or you're going to push yourself further into the negative.
Agreed.
And nobody's perfect, right? So you can't, if you're doing something negative, like just don't beat yourself up about it. Just try not to do it all the time. And if you're doing something positive, be like, that's great, and try to do it all the time. So, you know, there are people, I've patients who I'm like, do you drink water? They're like, no. I'm like, okay. So today, can you try to do X, Y, Z? So I think people in general, if you really want to look at your health and start to improve it, you have to really look at your behaviors, look at the things that you do that are good, look at the things that you do that aren't good. Try to see what's going to give you the biggest bang for your buck time-wise and effort-wise.
Okay.
Look at that, because that might not be the easiest thing, but then look at the easiest things that you could do and then make yourself a plan that way. Like my own personal plan, which I try to stick to, it's so simple. I try to make myself drink 8 glasses of water a day. I make myself have 3 to 5 vegetables. And I make myself walk the dogs. That's the only thing that I hold myself accountable to. You know, I do other stuff, right? Like I exercise, but I haven't been, this whole pandemic, I have more time on my hands than ever, but I'm like, I don't want to do anything, you know? Or I love eating ice cream and I love cocktails, right? So I'm not going to beat myself up about it, but
absolutes don't really work. So your experience has been absolutes don't work.
No, you have to give yourself grace, and you have to think of your own self. Like you might be great at getting 8 hours of sleep, but you might like I don't know, not move enough during the day. So you might be a person where you want to like set your phone for the health thing and try to make yourself get whatever steps a day. My mother-in-law is 80 and she's adorable and she counts her steps every day. And that's what she does, you know? So it's just, I tell patients all the time, I mean, you have to look at like, what can you do?
Right.
What's easy? And if something isn't easy, don't make yourself do it. Like, don't start with the hard stuff.
No one tells you that, though. You know,
I will.
Well, I know you will, doctor. I think what happens is we're marketed in a way that either the pill's going to fix the problem, or it's like keto. You take a keto diet. If you follow the strict keto diet, and they never tell you to moderate or slide into it, everything is really, you jump on this bandwagon, you do it, and you see results, especially weight loss related. And then you slowly ebb away from it. It's almost, that long-term discipline is hard. It's hard.
Yeah, sustainability is difficult in any habit.
Yeah,
so,
it's a habit. Yeah, your eating pattern is certainly a habit.
Yeah.
Okay, holistic in general.
I was going to ask you about your regimen. Do you have?
Oh, I'll tell you. So the pandemic for me has been wonderful in regards to. I lost 37 pounds.
It's awesome.
It's pretty apparent when you go back and look at the early shows to now. It's pretty obvious. But walking, not in, doing some fasting. You know, I don't mean like multiple day fasting, but like on Sundays I try not to eat for about an 18-hour period. Just things that, but I feel the other benefits, like the alertness, cognitively. And you say things like that, people don't really grasp what you're saying. But once the weight was off and I felt better, I was able to perform just my job and do other things. And the things I enjoyed more, it seems like I enjoy them more.
Yeah.
And it's easy to say it to someone who's maybe starting out, but I'm there now. I get it. I get it.
It was like you were carrying around a 4-year-old all the time.
Oh, I know. I'm not even where I'm like 20 pounds off of or 18 pounds off of the BMI weight or whatever I'm supposed to be at. But I don't know how accurate those are. Those were, are those tables from way back when humans were, I don't know, not overeating all the time?
I don't know. Well, just because we choose to do something doesn't make the table wrong. Perhaps it makes us wrong.
Okay.
You know? Like, because people will fight that table all the time, and you know the accuracy and your composition is a thing. Yeah. But in a pinch, I say, like, you know, it's an easy tool to use in a pinch. Yeah. Versus like, you know, really like doing, what do? They immerse you in water and see how much water the water displacement method for body to compensate. By the time you do that, like, you're either like somewhere close to like the table or you're not. Like, do you have to fit right in the box? Maybe not, but yeah. But I'm happy for you. That's
Thank
a good
you.
thing. You're welcome.
It's and you want to, you know, those will ask you, the first thing they'll ask you, are you sick? It's a shame, but I get that a lot. You know, like, are you sick? The assumption is if someone loses the weight, that they're trying to get in better shape, we go right to that. That's a shame. But everybody's just curious, and it really it's a discipline thing. Yeah. There's no way around it for me. I don't see it any other way for me. Right. I just, moderation, absolutely, but there's just some things I know that I can't go down that route, because if I have that potato chip and I stare at it as I'm doing things in the house, I'm going to have that whole bag. So I have to be disciplined enough to stay away from. Yeah. It comes back to knowing yourself, right? Yeah. I mean, or examining yourself.
Yeah, your poison.
My poison. And sugar, I'm sure, is part of that too. But I tried all this stuff. I tried the primal blueprint. I tried, and when I enter into absolutes, it doesn't work for me. It's like a famous musician I worked with years ago. He said he lost weight and got in health, but one of his doctors told him like 2 decades ago he couldn't eat ice cream anymore. Yeah. And he said, Doc, I can't do that. I guess I'm not going to be able. So he lost all his weight, got healthy, and was still eating ice cream in moderation. Yeah. But why is moderation so hard for us?
Well, I mean, there's that tipping point. I mean, they talk about like the tipping point with foods where, I mean, there are engineers that engineer the flavor of foods to hit all the satiety centers in our brain, which is usually like sugar, fat, and salt. Okay. And then it like fires off your sensors. It was like the experiment that they did with Oreos and cocaine with the mice.
I didn't hear about that.
Yeah, this was a couple years ago. They like basically like wanted to see whether, you know, and what happened was they did this experiment. There were Oreos. There was, I think it was cocaine. It was something really addictive and awesome. And so they let the like rats eat whatever. And here it was like rats were addicted to Oreos. And they were talking about like cheese being like addictive. Like the stuff that hits the satiety centers in our brain fires up all those neurotransmitters, and it gives you like a high. So that's why you want more of it.
Interesting.
Yeah.
Interesting.
Yeah, I ate almost half a pint of Ben and Jerry's mint cookie ice cream last night, so I know all about it. I had it.
See, even the physicians. People have to understand the physicians struggle too. I had a physician when I was young who was a family doctor for. He's a massive smoker, and he would tell you, do not do, do what I say, but don't look too close. So, I mean, that obviously doesn't work anymore in medicine. I mean, obviously, we're always looking for good examples too, which I'm sure has put you folks on tough ground too. You want to be an example.
Absolutely, you have to be.
We're all human too.
Well, yeah, it's I think it's the best peer pressure that I've had is being a chiropractor, like between going to school with really healthy people and then coming out. And I mean, if you tell your patients you have to do X, Y, and Z, you should be doing X, Y, and Z. I mean, I am super aware of posture. That's why I exercise. I'm like, I don't want to be, I know, me too. It's like, I think about it all the time because we're all like this.
Yeah,
all the time.
This thing makes me always.
Yeah, you have to set this up in the chair.
I think about that once in a while. I'm sitting here like,
yeah,
that's not good.
Well, and I laugh because I had a really bad back injury, like in 2015, like laid me up. I was, and I've been a chiropractic patient for years, but usually a wellness patient.
Okay.
But I got a taste of my own medicine where I was like, I used to think patient, it made me a better doctor, but it's like, how embarrassing is that where you like cannot work? I couldn't work for like 2 weeks and I'd be in the office and I'd come in and I'd like sign papers because I couldn't sit down and I'd like get adjusted and I'd go home and like lay on the floor and be like real sad. But it was funny because I'm like, this is the most embarrassing thing because when you are a chiropractor, you should not have a bad back, which I don't anymore. Like I'm like better now, but I had to do a lot of like work around it, So there's a lot of positive peer pressure in being a doctor.
Okay.
Yeah.
So talk about chiropractic specifically, because let's assume, even me, I'm a novice when it comes to it. Go in depth a little bit with chiropractic. What is it? Any background in how it treats, how it also treats the emotional part or the psychological part of a human? Because I know it does.
Sure, absolutely. So without getting into, I mean, the most pure form of chiropractic would be what we call like a straight chiropractor.
Okay.
And they are doctors who only adjust the spine. Okay. A lot of chiropractors, myself included, we're mixers now. But when we're talking about chiropractic in its pure form, it is essentially the science, art, and philosophy of understanding the connection between the nervous system and every cell in your body. So we have our brain turns into our spinal cord turns into our nerves come out and they branch, and every single cell, muscle, organ, and tissue in our body is connected back to the brain through nerve fibers.
Okay.
Then the brain coordinates all the cellular activity by sending and receiving messages through the nerves 24/7. And the body's innate drive is for homeostasis. So it wants everything to be balanced in relationship to its external and internal factors. So the body's always calculating chemically, mechanically, like, what do I need to do next? Your brain is always replacing the cells that are dying. If you have an injury, your brain sets up a chemical cascade to heal it. So the brain is connected.
It's an amazing machine.
Totally. And they say in the adult human body, one of my favorite trivia facts is that we have more neurons, which are nerve cells, inside the human body than there are stars in the Milky Way galaxy.
It's amazing.
It's crazy. So in history, and embryologically, the very first thing to form whenever we're an egg and a sperm and we start dividing, you have this lump of stem cells, and then the very first discernible, stem cells can turn into anything. They're pure potential. But the very first thing that happens is that the embryo gets this like dark spot, and then it gets a tail, and that's the primitive brain and spinal cord. And then everything that happens in that, embryo, fetus, baby, as it develops, is under the control of its own primitive brain and brain and spinal cord. So that's how we're histologically connected. But what happens to our body as we go through our lifetime is that we experience stress, right? There's 3 big stressors to the human body. One of them is physical stressors, which people tend to think of as like falling over, getting hit by a car, like big things.
Right.
But the physical stressors are things like gravity and our body weight and how we carry our purse and, how we walk. So physical stresses are anything that affects us physically. There's neuro-emotional stressors, which are our thoughts, how we perceive the world.
Right.
And chemical stressors. So what we take in and ingest, air, food, water, whether it's on purpose or by accident, just because of exposure.
Right.
So all of those things create stress to our brain, our nervous system, and our body responds accordingly. So the idea is that when stress affects our body, it can change, in particular physical stresses and probably neuroemotional stresses because of how we're wired. The stresses can change the alignment of specifically the spinal bones, but also the other structural bones in the body.
Okay.
And when that happens, that creates changes in the way nerves send and receive messages. Okay. Most of us actually get our first misalignment being born. So if you have kids, right? Mm-hmm. So usually there's, they're being delivered, there's a rotation of the cervical spine and then out. So you find lots of infants actually have cervical misalignment. And
from birth.
Yes. And then if you've ever, you watch a baby learn how to walk, they fall over 1,000,000 times a day. Then they fight their brothers in the yard. And then, like the poorly landed somersaults in gymnastics class,
yes.
Yeah. And so all of that stuff sort of layers. So as we go through our lifetime, we get more and more neurological compromise.
Okay.
A lot of people will talk about having like a pinched nerve and think of it being something painful, when in reality, it's not so much that the nerve gets pinched, because truly a pinched nerve, like if you were to have a bone like slide and like pinch off a nerve, like that's really like a surgical emergency.
Yeah, I would think so.
But what happens more is that the malposition actually tractions the covering of a nerve. So remember the game when you were a kid, I think they would call it, and it's probably not PC, but they call it like the Chinese finger trap, where you go like this. Mm-hmm. Okay, so it tractions the covering of the nerve, and then it changes, certain cells in the nerve start to die. It changes the flow of circulation to the nerve root and things like that. And the vast majority of the fibers inside a nerve root don't feel pain. They control function. So they might have an effect on your organs or your muscle movement. A big thing that happens when people get out of misalignment is that the neurons that tell us where we are in space start to die. Okay. That's why you start to see like poor posture and shuffling gait and things. I know. I promise I'm not picking on you. But they lose.
That's all right. I got to talk to you about this when we're done here.
They lose position sense, and reaction time is different and things like that. So by the time people are typically aware of something being painful, some people, I almost feel like they get lucky if they have pain right away, because then they're called to do something about it. But I can take x-rays on somebody and see arthritis that has been in a malposition. It took like 20 years for it to develop, but they're like, my neck has been stiff for 2 months. I'm like, no, your neck has really been stiff for 20 years, but you couldn't tell because like these little teeny bones, you don't notice when one of them is stuck. It might take a big change to see that. So the idea is, you adjust the patient, you realign the bones, which induces movement. When you induce movement into the position, it helps to allow the nerve to function better. Okay. It allows circulation to the nerve to go back to being normal. Right. The nerve can start to get better messages out to the body and into the body, and the body will drive itself to try to get homeostasis. It's quite simple.
Quite simple.
Just like that.
When I was a kid, going a long time ago, going back to the 70s, and I grew up in a mill town, so I wouldn't say there was a lot of degreed people here. A lot of people weren't going to school. They were raising us anyways. Yeah. Chiropractic got a bad rep.
Sure.
It was the era that was kind of getting, it was, my parents didn't believe in it. My grandparents absolutely didn't believe it. But I had a grandmother who taught nursing at a major university here who did. And she goes, but none of my colleagues do. I remember her telling me that when I was younger, because we had a couple chiropractic in the area, doctors, and didn't know. Why? We talked a little bit about the evolution of holistic medicine, but talk a little bit about the evolution of chiropractic in terms of acceptance in society.
Sure. Well, there's actually a Simpsons about that. I don't know if you've ever seen the one where Homer has
religious.
Back
no,
pain.
It's not a religious Simpsons watch.
His doctor, who I think they fashioned after Bill Cosby, the doctor says to Homer at one point, he tells him to go to the chiropractor, and Homer's like, I didn't think that you guys did that. And he's like, I'll never say it openly, but they're great for my golf game. Like, that's kind of like what he says. Actually, it's interesting because I've seen that change even during my tenure. Okay. So
since 99.
Since 99. Okay. Yeah. It's so funny. It feels like so long ago right now. In the early 1900s, chiropractic came to be as a profession in the late 1870s, as did osteopathy, and they kind of came out at the same time. And they practiced and they did their thing, and chiropractors and osteopaths, their practice was relatively similar. Chiropractors were adjusting their patients for the purpose of restoring normal nerve flow. Okay. Osteopaths were adjusting their patients for the sake of restoring normal circulatory patterns, but it kind of looked the same. And the American Medical Association was founded in the late 1800s to protect the financial and political interests of allopathic, aka medical physicians, now known as MDs. So they became a very powerful political force, and in the early 1900s, like maybe 1910s to 1920s, they began campaigns to try to eliminate competitors to their medical physicians. So they targeted dentists, chiropractors, osteopaths, midwives. There was a whole litany of people that they were against. And they basically, there was pressure, and they, in chiropractic specifically and in osteopathy, they would say, you're practicing medicine without a license, because we didn't have licensure. Neither did osteopaths, I believe, at that time. So they would basically, if you were adjusting patients, you could get arrested for practicing medicine without a license. It's true. And there are stories, like there was one guy in Ohio, I think he got arrested like 12 times. Like he would get out of jail and he'd go back and adjust patients and get arrested again. And I feel like, his poor wife was probably like, just stop it. But anyway, yeah, you could get arrested for practicing medicine without a license. So, chiropractors differentiated themselves and wrote, their act of practice or whatever that said, this is what we do. We, correct subluxation for the purpose of healing the body. Osteopaths started to do their thing, and they actually became more medical in their approach. And now you can have a DO or an MD, and they practice the same.
Okay.
Although osteopaths are taught in school, some of them, I believe, can take classes on like spinal mobilization, and they can do some, gross spinal mobilization for their patients.
Okay.
Although a lot of them don't practice that way. So it continued. So, and way up into there were, physicians were taught that chiropractors were cultist quacks, I think is a direct quote from the AMA. That was
a direct quote from the AMA?
Yeah.
How far are we going back now?
1940s to 1960s,
okay.
Unscientific cultist quacks, I believe is the direct quote.
Wow.
Yeah, and so it continued on. And I mean, mind you, you're a physician and that's what you're taught. Like, you don't want to jeopardize your patient's health by sending them to the unscientific cultist quack, and they didn't know any better. So that continued, and there was actually like a committee on quackery that was during the time, I believe, of like Nixon, where they,
of course,
yeah, and there are videos. Like, there's videos of them being interviewed about chiropractic and like the propaganda they were spreading. And the one guy was like, I wouldn't know a chiropractor from a reindeer or something like weird. They were really, but they didn't know. And it was purely a political and financial thing. They had no, basis in fact. And in the 1970s, a group of chiropractors in Chicago pressed a lawsuit against the American Medical Association. And it went all the way up to the Supreme Court, and it was finally settled where the Supreme Court was found guilty of, and once again, quote, attempting to contain and eliminate the profession of chiropractic using untrue and unjust means. So they had to cease and desist all their anti-chiropractic propaganda. They had to change their curriculum in schools. They had to encourage cooperation.
Okay.
So that
was a landmark decision then.
Yes.
Had to have been.
Yeah, it's called Wilkes versus the AMA, if you want to look at it.
Okay.
And that sort of started to change things. And then there was the Insurance Equality Act that also came out in the late 1970s that said that insurance carriers had to include chiropractors. Mind you, they can choose how they do. Like, you might have a $200 copay for my $45 adjustment, but
yeah, they can still be biased.
Yeah. So that's what happened. And even, when I came out of school in 1999, they were still, there were a lot of patients that were like, I would do spinal screenings at events, and they'd be like, oh, you're a quack. And I'm like, sure. You still have terrible posture, and you probably need me, so you should let me check you. Yeah. You get really thick skin. I say, like, you end up with like a big heart and thick skin. And that's, been part of what's allowed me to have some humor in some of the battles and conversations I've had.
Got it.
But it's much more inclusive now, although it still comes with some challenges. And we decided to medically integrate in 2018. So not only do we encourage cooperation, we tell patients, tell your primary care doctor. We send, exam findings over all this other stuff. But we actually now have a medical director on staff. He was a chiropractor for 17 years.
Okay.
And then he went to school to become an MD, and now he's a physiatrist, which is a doctor who does additional training in pain management and rehabilitation.
Okay.
It's awesome. And
to get away from just taking medication.
Correct.
Okay.
Yeah. And they can do medication management.
If required.
Yeah.
It's more of a last resort kind of thing. Am I right?
Yeah. Yeah. And patients get to that point. I mean, we have a nurse practitioner also. So not only do we encourage cooperation, we give patients like access to people who are also holistically minded, but have the tools in their toolbox to be able to do the medical thing if they need to, which is kind of cool.
And that's a wholesale change in medicine then.
Yeah.
It has to be a wholesale, because even in treating cancer and how they approach cancer now, there's holistic medicine there as well too.
It's awesome. Yeah, they've done a lot of really good integration with cancer treatment, where they've done mind-body therapies and acupuncture, and
right.
it's amazing. Yeah, because if you think about, and let's talk about like the scariest disease, right? That's probably
big C word, right?
Yeah, I'm definitely I'd much rather have like a giant heart attack and die than get cancer.
Have it be prolonged, long, drawn out like that.
Yeah.
The holistic thing is fascinating to me in that when I was younger, I remember my parents poo-pooing the idea of vitamins, even when it was being commercially sold to us as the Flintstones vitamins on
so
television. It was candy,
they're still
right?
good. They're so good.
But even that generation and their generation prior, at least in this area, any pill you're going to take that's not prescribed by a doctor is bad.
Yeah.
So we've had a wholesale change in society where, I guess, would you say the willingness of society to try vitamins or vitamin related products, that's been part of that change?
Absolutely.
Okay.
Absolutely. I mean, people, and they research. I think with the internet, people always talk about the bad things on the internet, but I mean, there are a lot of really good things that have come of that, where people have been more likely, like they'll read something and they'll be like, I want to try that, and they'll really understand like the potential benefits and risks, and they'll do that,
Well, chiropractic has to be, I would imagine, extremely important in pain management.
Absolutely.
As against taking opioids, and not that opioids don't have their place for extremely bad situations. I get it, but anyone, I would imagine, would rather try chiropractic if it was presented to them correctly, as opposed to going the prescription route, right?
I wouldn't say anyone, but I would say most people.
Okay.
So there's still, I guess if you interview people, like, would you ever go to a chiropractor? Like 75% say yes.
Okay.
And 25% say never. Having never
There's
been.
no one in the middle.
Yeah. Well, I don't know. I mean, if you give a yes or no answer, you have to choose yes or no.
Right.
We didn't want to, maybe for simplicity's sake, there aren't maybes.
Right.
But yeah, I think that has been something that we've seen change in the past maybe 10 years as the opioid crisis became more like apparent. Because prior to that, it wasn't, people weren't that worried because we weren't seeing what was happening,
Okay.
And even Purdue Pharma, who produces, I believe it's OxyContin or Vicodin, I can't remember which one, there was a huge lawsuit against them. And I think it was like a $454 million settlement because they were advertising falsely to physicians that their product was longer lasting and less addictive than other types of, yes. I'm not making it up. I should have read all my citations today with my footnotes.
It just sounds so comical in its absurdity.
But they were. So, these physicians were being like marketed to that way, and they were prescribing it, and they didn't know what the long-term effects were. I think the first person I heard come out about like opioid addiction that was very like well-known was Rush Limbaugh.
Okay. I remember, early mid-90s, early 2000s?
Early 2000s, yeah. Because it was after I was already in practice.
Right.
And then like People magazine, I think it was, or maybe it was Time, had a big article about, if you take one of these medications once, like one a day for 30 days, you have like a X amount chance of being an addict, or one a day for 60 days and having an X amount chance of being an addict. I remember getting like I think it was like one of my siblings had something going on with their teeth where they had to get a bunch of teeth pulled. They came out with a bottle of Vicodin like this, and I was like, nope, not having
Did it
it.
evolve from like Ativan and Valium being like the 50s and 60s kind of, those two drugs milder compared to the opiates today?
Well, they do different things.
Okay.
They're used for different things.
Okay.
And in the 50s and 60s, you saw like, what was it? The Valley of the Dolls was all about that, I think.
That's right. That's right.
So yeah, it was just different. And I think that, for the people that need them, the new classification, like the old opioid was morphine, right?
Oh yeah. That was more pain related. The Valium, and it was for anxiety back then, right?
Yeah. Anxiety and things like that.
Okay.
So with opioids, you would have, that you would have morphine, or maybe Percocet, and then these evolved. So I think the evolution of them was necessary. I think that people didn't know how to prescribe them.
Okay.
And because the body attenuates to them so quickly, like our body literally like attenuates to them and gets used to them. So people need higher and higher doses.
Tolerance.
Yes. To get the same effect. And that's where you get into trouble, you know? And there are even things now when people are doing, one of the things I learned from our medical director was like, you know, they can do these pain pumps. When people truly do have chronic pain and they need to take these medications, you can do an intrathecal pain pump. And basically it uses like 1/10 of the medication to get the same result because it's not going through the patient's bloodstream. It's directly at the source of it.
Right.
Yeah, and it's an amazing thing, and it would reduce overdose deaths and things like that, and could potentially save lives. But insurance companies aren't quick to cover it. You kind of have to fail opioid therapy, and even medical marijuana. They talk about that because that using medical marijuana along with the opioid pain reliever, it has a synergistic effect. So people can typically take less opioid, combine it with the medical marijuana, and they'll get a very good pain relief effect. And gradually, some patients have been able to wean off. But there's lots of stopgaps with that because even like, if you're a physician writing prescriptions for opioids, they're attached to your DEA number and they're tracked and all that other stuff because they do not want the Dr. Feelgoods running around doing that. But at the same time, like those physicians are reluctant, if a patient is taking medical marijuana, like because it's not federally legal and their DEA number is, it becomes this political thing, So really at the end of the day, like opioids probably, do have and had their place for patients who really needed them, but they were prescribed erroneously, I guess, or people would also, when you're an addict, you do whatever you can to get what you need. So physicians were dealing with people that are drug seeking and pretending, or
and that's a whole, the paranoia in your field for those people that are dispensing those drugs has to be off the charts.
Yeah, and in our practice we don't, even though we have medical providers, we don't do opioids or narcotics because there are so many risks. And when people do get to the point where they are dependent, if they don't have them, like let's say a patient knows that they are dependent, but they're controlling it and whatever, if they don't have them, they go into terrible withdrawal, which is a problem. Or if they're dependent and they're not controlling it well, they will lie and doctor hop and send other family members in. I mean, imagine having somebody who's, my pain's so bad, my doctor won't give me any more medicine. Like they'll send family members in, it's just a mess. So, I'm hoping and I'm hopeful, although I don't know the statistics, that as people explore more alternative therapies and as, our generation and the people that are younger than us, and even the people that are older than us, see what's happening, that they will look at that as a last resort. And I have patients who, have pain, could probably benefit from some type of medication, even like an NSAID or a steroid, and they're like, not doing it because they don't want to.
Yeah.
And they'll just tough it out.
I know a lot of people that way. I'm kind of like that. I would prefer not to take anything if I can help it. I got through a headache. I got through pain. Probably not the wisest thing in the world at times, but it's I think there's a healthy skepticism, and as more we learn more about our own health, or we take more responsibility for our own health.
Yes.
I think more and more of that anti-pill is, and anti-pill's kind of an odd term because a pill could be a vitamin versus Percodan.
Right.
There's everything in between, right?
Yeah.
But I think taking that pill, even for me, it's even the mental concept of taking a pill.
Right. They don't want to.
Yeah.
Yeah. It's like I don't want that.
Yeah. Why are we like that though? Because I can tell you, I am like that.
Well, I don't know. I mean, I think in healthy skepticism is a good thing. So sometimes it's healthy skepticism. Sometimes it's just knowing, like, I don't need that. I don't want to go there. Like, I would do that as a last resort. And it's just their own philosophy of what they want inside their body, And some people can gut it out. Like, I've seen patients who I'm like, oh my goodness, please, like, you need to talk to somebody about, like, whatever. And they're like, nope, not doing it. I'm like, okay, like, then come see me every day until we get on top of this, because I don't want you running around miserable, I
remember being brave and telling I rarely ever had a dental problem with it. Telling my dentist that I want to try this without Novocaine.
Oh.
And he gave me 5 warnings. He says, look, I really don't want to do this without Novocaine. I really don't want to do it. I will do it if you tell me to.
Yeah.
And it was no more than 20 seconds in, I was changing my mind.
Yeah.
But, I guess that's tooth pain, something else.
Oh my God, right? My grandma used to get her dental work done without Novocaine, and I'm like,
whiskey maybe. Or
it makes like all my hair stand up just thinking about like between the noise. And I like going to the dentist. I'm not afraid, but between the noise and having that like, woo, I jump out of the seat. Like I don't know.
And the smell of the smell though of the drill. That's the drill smell, and then the pain, and then
no, definitely say yes to Novocaine.
Yeah, I learned right away. I have to come off my high horse for sure. Restorative medicine.
Yes.
Let's talk about that.
Yes. So restorative medicine is really, it's probably more likely to call it regenerative medicine.
Regenerative, okay.
Yeah, but we liked the word restorative better, so that's why we changed our name to Choice Restorative Medicine. So the idea behind restorative and regenerative medicine is to use the science of things like cellular medicine, nutrition, things like that to help the body restore itself to a better state of being, right? So a lot of things could be considered restorative medicine, like your supplementation, like if you're trying to help your body make better cells, taking fish oils and things like that allow you to do that.
NAI, I take basis. You familiar with basis?
Yeah.
Okay. I think it's naiads, I think.
Okay. No,
I don't know.
I'm not that.
It made sense when I started thinking.
Yeah.
I can talk about it another time, but it's I just wanted to. You said cellular regeneration.
Yeah. So our body's making cells all the time, and as we age, our body's ability to repair itself goes down because of oxidative stress.
Okay.
Actually, our DNA, like each time a cell replicates, our DNA gets worn down a little bit, so the quality of our cells isn't as good.
Right.
Our circulatory system changes, and we need oxygen to keep our cells healthy. So because that's not always great, our cells die more and they're not being replaced as fast, and it just it's the basically aging or injury are the two things that can accelerate cellular death and loss, right? So in our clinic, the two forms of truly regenerative medicine that we do are platelet rich plasma and umbilical cord blood stem cells.
Okay.
I started wanting to use both of those things because though we are lucky, and in the vast majority of our patients, they're going to get better, they're going to heal, they're not going to need those things. We will have patients where, like, let's say, your whole entire body's doing great except for your right knee has, an old meniscus tear or an old surgery that you had and it doesn't work right. So it's always a bit painful, and it changes how you walk, and it keeps making the rest of you wonky, crooked, painful.
It's a quality of life issue too.
Yeah. Or you can't, or like you can't golf, or, your shoulder, you've hurt your shoulder a bunch of times and you don't really want to get, a surgery, but you're at the, and you're not there. So, in the meantime, you have this bad shoulder and you're taking an NSAID every day just to keep your arthritis down. So like we would have patients where they would get better to a certain point and then maybe plateau.
Okay.
Or we would have them where like one part of them wasn't working the way that it should, and it would inhibit them. And a lot of times when you get to that point, the patient's like, okay, so you send them back to their PCP or you send them to their orthopedic, and that doctor, maybe gives them a shot of cortisone and is like, yeah, you kind of have to live with it, go do PT, but eventually you're going to need XYZ down the road. But that whole space between where we are now and like 10 years from now when that patient might need a knee replacement, like it's not good quality of life, and they're exposing themselves typically to oral medications, NSAIDs, not being as active as they want to be, which plays out on other parts of their health. And so I basically just decided, I'm like, there is this science out there where you can give patients tools, like, you can use platelet rich plasma, you can use umbilical cord blood to do a bunch of things and actually get their body to repair itself better. Okay. And then they can run around and do what they want to do and maybe never need a surgery, or down the line, extend the duration of that,
quality of life.
Yeah. Like I have a client who had a knee replacement, his first one when he was 34.
Wow.
He is going to need another one because you outlive your joint replacements and stuff like that. So yeah. So, and it's that sort of stuff has been happening. I mean, it's been around in Europe for forever, platelet-rich plasma has been used in the United States widely since the 1970s.
What is that?
Platelet-rich plasma, people call it PRP. It's where you do a blood draw. You use a special centrifuge and it concentrates your platelets. And when the platelet concentration is very high, you can put the platelets back into the body's tissues, and they actually, I hate to say it, I always say they're like a catalyst, but they like aggravate your body's healing response. So let's say you have something that's chronically painful, like you have tennis elbow. It's always painful, blah, 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 and you've done all the things. So you can take platelets and put them in there. When you put the platelets in there, your body, your brain picks up on that, and it's an irritant almost. So then your brain starts sending healing chemicals and collagen and all those other things. So platelet-rich plasma helps your body to build collagen, which fortifies tissues, and it helps your body grow a new blood supply. Okay. It's also really good at like helping to like clean up old scar tissue. So let's say you have an old injury and it healed stiff. You can use platelet-rich plasma. It evokes that chemical change in the tissue. And if you're working with a physical therapist or a chiropractor or a personal trainer on getting your range of motion back, you'll probably get greater gains. And it helps to really ameliorate pain.
How long has that been around?
That's been since the 70s.
Really?
Yeah. And it used to just you would see it in like athletes more, like all the people that had like, you know, whatever to get that, you know, have access to like the really cool stuff, like they would get that stuff.
Was it cost related? It was prohibitive cost related prior? Or?
I just think not a lot of physicians were doing it. I mean, popularity. Literally like the first physician at AGH to do it was Dr. Snell, I believe. Okay. And I only started hearing about him doing it probably like 10 to 12 years ago.
Got it.
But it'd been around. But it was more like progressive and a little bit woo-woo, you know, out there. But yeah, so you can use that. And then the science of stem cell, what they call stem cell, has also been around for a long time, although it wasn't widely used because, you know, in Europe, I mean, they do stuff in front of us all the time. With stem cell treatments, you can get stem cells from a lot of different sources. So some clinics will get stem cells from the patient where, you know, they'll harvest them out of our bone marrow or our fat.
Right.
Other places we use donor cells, so we get them from umbilical cord blood, which is basically donated from live healthy births. And every single hospital that delivers babies also knows how to bank cord blood.
Right.
And so those are the two ways that you can primarily get that here in the United States. But there was a lot of controversy for a while because there was the idea like they didn't want people using like embryos or fetuses or all that other stuff, or having an incentive for somebody to get pregnant and have...
It became a political issue for a long time too.
Yeah, exactly. And some people still have that misunderstanding. They're like, oh, you know, if I do this, is it going to cause abortions? No, like that's not how it works. And the type of stem cell, I mean, we use stem cells for orthopedic issues, primarily muscular issues, things like that. There are, I mean, they use stem cells for cancer treatment. Right. There are so many different studies, and you know, there are different types of stem cells, and if they are using stem cells for higher levels of research, like organ regeneration and the stuff that happens like at extremely sensitive and complex scientific levels, their stem cells are typically derived from people that do like in vitro fertilization, and they have these frozen stem cells, and they're never going to implant them, so they just, you know, they're there, so those can be donated, but that's not what is available to people in the mass market, you know. Yeah, but you can use stem cells. You know, there are people who use them for systemic disorders like fibromyalgia, rheumatoid arthritis, things like that. I have a client, he doesn't do it with me, but he has sarcoidosis, which is a lung problem. And he gets stem cell treatments through a nebulizer annually.
Really?
Yeah. Because stem cells, they're smart, right? That's the funny thing about them is they're sentient and sensing, and different types of stem cells have the capability to turn into different types of cells, depending on where they're derived from. So you can do these stem cell treatments. And when you put stem cells into an area where there's cellular distress, the cells that are distressed or dying or whatever, they give off these chemicals that are signals. That's how your brain picks them up and knows how to like repair them anyway. The stem cells pick up on those signals, and those signals help to trigger what they decide to turn into. And so whenever you're doing those treatments, you can direct them towards certain body tissues.
It's amazing.
They're the smartest. It's like, I know. I keep telling patients, I'm like, I mean, implementing these things into our practice wasn't easy. We have a great practice. We had a great practice. We didn't need to do any of this. Right. But it was so cool and like so good for people that I felt compelled and passionate about bringing it to people and teaching people about it. Because, you know, you have this at your hand, and you have, you know, somebody who's suffering, and if this is a potential way to like use something that's gentle, I mean, your body you can't have a rejection reaction because they're not immuno matched. So it's, you know, that's safe. it's a heck of a lot safer to have an injection versus anesthesia and incision, all that other stuff. The downtime is minimal. And if a person has the right type of factors in their body, they're likely to get a good result.
It's that good.
It is good.
Yeah.
And some people can't. I mean, we've had clients where they've come to us and they've, their problem is so bad that we know that they're probably not going to get a good outcome.
Okay.
So part of this was like, number one, bringing it to people and teaching them about the science of like allowing their body to heal itself. And the other thing was doing it in an ethical fashion. There are lots of stem cell clinics that do a lot of procedures, and the patient doesn't have the right factors to get a good result. They're either too far gone. If somebody really truly is bone on bone, we're probably not going to be able to do that much to help them. If somebody is very, very aged, like we can still help them, but their result may be limited. If somebody has a poor circulatory system, if their immune system is shot, like all of these things work with your immune system. So the patient has to have an intact immune system. They have to be not too far gone. I have a client who, she has chronic shoulder pain. I would love to be able to treat her with stem cell, but when you look at her x-rays, her humeral heads are so deformed that's not going to change,
Got it.
So you kind of have to, there's like a window where like you can have damage, but there's a window where you lose the body, it's just like,
will be effective.
Exactly.
So integrity has to be extremely high for the patient to be properly taken care of, like
Absolutely.
with any practice. But I mean, in that regards as well, because that would lead to manipulation for someone that was unscrupulous to do it.
Yeah.
I mean, and you're not here to talk about any other practices either, but I understand that. Yeah.
Well, and I never want to be that person.
Yeah.
Like that was, and it was risky,
Understood.
when you take something, you're known for this and you're going to add this, like I wanted to do it the right way with the right people and with physicians who really like cared about our patients.
Right.
And I'm also, as much as we talk about like thick skin and a big heart, like I live in the community that I serve. I've been around for a long time.
Well, talk about your practice.
I never want to be like that person. What about, I feel like I've talked about my practice all morning.
We do talk about elements of what you do at your practice, but your particular practice. So did you start in 99, you were working for, did you start out working for another?
Yeah, I did actually. Okay. I worked for Lee Newman on the South Side. Okay. So he's still is a chiropractor. He's not in Pittsburgh anymore, but he was doing a program where he would develop young associate doctors. I never wanted to own a practice. I never wanted to come back to Pittsburgh. But I'm so happy.
About that for honesty.
I didn't want to be a chiropractor. I didn't know what that is. So no, but it's we talk about, like I say, I'm super planned, but all the things that have been major decisions in my life have not been things that I've chosen on purpose.
Okay.
But it was cool. So I came back to Pittsburgh and I ended up working for him, and he was doing this associate development thing. And it was amazing because, he's, I love him. He's like my big brother. I always say all the time, because I'm the oldest. I don't have a big brother, but he's my big brother, and he's a very strong personality. So you either get him and you love him, or you're like, I never want to talk to that guy again. And we've had a wonderful relationship over the years. But it wasn't always easy, but that was also because he was pushing me, but he was one of the most influential people in my own development, both as a person and as a professional. Okay. And one of the things that was really cool was he was one of the most feminist men I ever met. So I used to be like, oh, nobody's going to take me seriously. Like, I'm 24, I'm a girl, like, whatever. And he's like, those are all your best tools. Like, you need to stand in that space and take up space and get what's yours and find the people that need you. Right. And so he was very empowering, and, he's kind of pushed me to meet. He's like, this is you being a chiropractor, cool. But a lot of chiropractors are really good chiropractors and they don't have a sustainable business. So you need to wrap your brain around this. So I did, and I just kind of did what he told me, and I found my way, and he was very supportive, and I had tons of mentors along the way. I joined a BNI group in 1999 when I started my practice, and met a bunch of other people that were entrepreneurs and learned about building networks and referrals and finding your friends in business. Way. And when somebody was good at something, I used to literally be like, can I just ask you how, if they were really good at getting their team motivated, or they were really good at XYZ, I would ask them to show me how they did it.
They didn't teach you that in medical school.
Oh, heck no.
That's the thing people don't understand. It's
No.
like, and lawyers tell us the same thing. And law school, they teach us how to be business people.
No, you don't. I mean, you can't. I mean, I don't think you can. Like, you take one class on marketing, they're like, do a marketing plan, draw your floor plan of your office. I'm like, okay. Like, I probably copied someone's, honestly.
Of
Like,
course,
I didn't know what
there's
I
nothing
was
wrong with
doing. Yeah. So, but in real life, you have to figure it out,
Right.
And so I was fortunate to work for him and under his mentorship. And he just taught me how to grow a practice. And once it started, like, it was awesome. And I bought my practice from him in 2001. So I started in this little clinic in the North Hills that a doctor basically like abandoned. And I was seeing like 20 patients in a week. And then that grew to like 9 times that in the 2 years that I was under him.
Smokes.
Yeah, but it was fun, right? And it was organic and it was fun. And I was out in the community. And then I bought that from him and then moved my practice to a bigger location and stayed there for 15 years. And during that time, I started to do my own associate development. So I've had a bunch of associates over the years. And 2 of my associates met their metrics enough that we were able to open satellite clinics for them. And I'm so proud of them. One of them's in Wexford, one of them's in Moon. And they're both still successful in practice. They figured out how to practice, have a family, which is almost impossible, and like be happy in the process and busy. And I'm still friends with both of them. I actually have a swimming date with one of them later. Yeah.
How about that?
Yeah. And her 4-year-old. So I did associate development for a while. And then in 2015, I started looking at, the long-term piece of my business. Like, what do I, how long do I want to practice this way? What do I want to do? And I partnered in. I have a partner now who's Dr. Ashley. So she is in my practice with me every day. And she is my successor if we both have things our way as we go. So started on that plan. But yeah, I mean, like day to day, we're there to serve people. We take care of a lot of patients. Our primary way of finding people is referrals. So we have most of our patients come from other patients. And in 2018, we took the leap and decided to medically integrate. So now we have chiropractic, we have some physical therapy modalities, we have a spinal decompression machine that like helps with arthritis and disc problems.
Just stretch you out. What does that
People call it the rack. It actually does.
The rack.
You need to come over. Come over, and we'll do some videos of you like trying these things.
Hey, I'm all for that.
Yeah, I would love to show you.
Yeah,
it's
I'm all
neat.
for that.
Yeah, the decompression tables.
We'll set it up.
Yeah, it's for people that have disc issues, whether it's disc degeneration or things like sciatica. And it really can make the difference between somebody responding well or somebody needing more invasive intervention.
Ouch.
We have a laser. It's a K laser, so we can laser things. It's very space age. And then we have our medical team, and our medical team does things like trigger point and joint injection. They can order braces. They do all of our PRP and our stem cells and things like that. And we also do PRP. One of my favorite things that we do, we're getting into the aesthetics with regenerative medicine. So I always laugh because I'm like, I want to age well and I want to look good, but I never want to look fake. Like, I barely wear makeup. And
yeah, I want to age well too.
You are aging well. You're doing well. My hubby's 54. You're 54. I'm like, the 54-year-olds are doing okay today.
I'm trying. We're trying.
But yeah, we can do, it's called a vampire facial, if you've ever watched the
vampire facial. No, what is that?
The Kardashians were the ones that did it. They made it so dramatic. But it's a tool called, it's microneedling. So it's like a tool that has, it almost looks like an electric toothbrush. And there's a head on it with all these teeny needles. They're thinner than acupuncture needles. But it's a very fast like oscillation. So you know how you like aerate your lawn to break up the root system and let new things grow? It kind of does that for your skin. So we use it for people who just want to do like anti-aging things for their skin. It can help with fine lines and texture. If somebody has acne scarring, it's FDA approved to reduce acne scars. So anybody that, and that's a big thing. Like,
no question about it.
Yeah. And, or if somebody has like a scar on their body or dark spots, you can use it for that. So the microneedling does this like really fast, like it almost feels like buzzing kind of. You get numb. You're not allowed to do this without Novocaine. It's not Novocaine. I forget what it's called, the stuff that they use. But
I'm all for Novocaine now.
But yeah, it's interesting. So it does like all of this fine like tapping oscillation, and then you use the PRP. You actually use the platelets and you rub them into the teeny tiny holes that are in there. So what it does is it stimulates your body to build collagen and bring blood flow to the surface. So it's like a way to boost your glow. And
boost my glow.
Boost your glow. Well, for men, we call it skin fitness.
Oh, okay.
Because that's more manly.
Marketing is something, isn't it?
You could have some skin fitness if you're a gentleman. If you're a woman, we call it
Glow.
organic facial rejuvenation.
But essentially, it's doing the same thing.
Absolutely. And we can also use it for hair restoration. So
I think, wow, that ship has sailed. But boy, where were you like 20 years ago?
I know. They could do it. They just, yeah. And it was neat. Like we had a client, we had to call. She was working on getting pregnant, but she also needed PRP in her knees.
Okay.
And our nurse practitioner reached out to her medical physician and was like, are you okay with us doing this and whatever. They actually use PRP now for women that are trying to conceive. They can do it to the uterine lining to help the uterine lining grow so that when an egg implants, it has like this nice like cushy nest to implant into.
Wow.
I know, cool, right?
Yeah.
So we get to do stuff like that, and then we do the stem cell stuff as well.
If I read this, my mind's blown. So if I read this correctly,
Yes.
and if I saw it correctly, there is a video of you giving chiropractic service to an animal.
Oh, yeah. That's why I'm dressed like this today. I'm actually going to see some animals later today.
We didn't talk about that at all. Let's talk
After
about
my
this.
swimming.
Okay.
Yeah, so I became a certified animal chiropractor in 2012,
Okay.
I think. And it was a combination of things that made me do that.
I didn't know it was even a thing.
Yeah. I didn't until I went to chiropractic school.
Okay.
And then here I go to chiropractic school, which is already weird enough to somebody that's like never even been to a chiropractor. And they're like talking about, I'm going to be an animal chiropractor. And I'm like, what? Mind blown. And I always have loved animals. Like we
Right.
had this cool mom that let us basically have 1 million pets and
Right.
yeah, all this stuff. So
Practicing on the dogs.
yeah. Well, I didn't know about chiropractic then, but we had these cats that would try to like kill everything. So we had a lot of wildlife rehab that happened in our garage when we were little.
Okay.
And a lot of pets. But yeah, so I learned about it in chiropractic school, but you couldn't take it in chiropractic school. Like you have to take it afterwards because it's its own separate certification and program.
Okay.
And when I graduated from chiropractic school and I came back to Pittsburgh, one of the very first things that I did was I became a dog owner. And I was like, it was a Great Dane, of course. Yeah, because I always
Right.
wanted one. I
Yeah,
walked
right
into the
to the
Humane Society.
mini
Yeah.
horse. Yes.
Well, I bought my first house and I was so sad. And I'm like, why am I sad? I'm like, oh, I need a dog. And I went to the Humane Society and I'd always wanted a Great Dane from when I was a girl. And I
Okay.
walked in and there was a Great
one
Dane that
there.
got there 20 minutes before me. And I was like,
Yeah, meant to
great.
be.
Yeah. Put him in my Geo Metro in the back seat.
How'd that work out?
It was fine. And I brought
Heads
him
out the window,
I
tails
brought-
out the other window.
Yeah, I brought him home. I was like winning. So yeah, and but I started taking him to get adjusted. Like I took him to a holistic vet who I actually know now, and she's a certified animal chiropractor in addition
Right.
to being a vet.
Right.
So I took him there, and I had another Dane that I got later. And everybody talks about these huge dogs and their orthopedic issues, and they never had orthopedic issues really. My second one, it was funny, actually did, but he blew out his crown ligament. He pulled a ligament in his knee and woke up limping. And my first experience with stem cell was I took him to Dr. Mike Hutchinson up in Cranberry, who was doing stem cell on animals way before anybody was doing it on people in Pittsburgh. And he fixed his knee with stem cells. Yeah. It wasn't fully torn. It was just like stretched out of place. But the way that it usually goes with that is, a dog gets a bad knee. They fix it. They usually do this like TPLO thing where they create like a fake knee with it, and then they blow out their other knee and have to have that one done. And I was like, I'm not having this with like a 150-pound animal.
Right.
So I got stem cells. I continued to take them to get adjusted, and at that point in time, the gentleman that I was taking them to get adjusted was like, you'd be great at this. You're already a chiropractor. Like, just go to the class. And he kind of like encouraged me to do that. So I decided to go, and thanks to my now partner, my associate doc would take over, and for 6 months, one like really long, I think it was like I would leave like Wednesday night and come home Sunday night. I would go down to Dallas, Texas, and do my classwork and do my modules. We would go to Barnes to do our practicals. So we did practical work on horses and all this other stuff. And I got certified and came back to Pittsburgh. And I did it out of a curiosity, just to want to learn to like improve my craft and use it a different way. So I did it out of that, and I found a really nice practice to work with. In Pennsylvania, you have to have direct supervision from a vet, so they have to be on site. So I see my animal clients at this really cool, independently female-owned, I'm plugging for Dr. Katie, practice called Bella Coop Animal Hospital. It's wonderful. Dr. Katie Strassmeyer-Stoller is the owner. She is amazing. Her staff team is amazing. So
Okay.
I sent out letters to all these different vet practices like, hey, can I potentially talk to you about adding this to your practice? I interviewed with a couple of them, but she really like got it. And she was like, yeah, like, let's do this. And I was like, yes. And like, I love working there. So it's nice because, you know, I have, if an animal comes in and they have something that I'm not comfortable with,
Right.
I can always refer them back to the vet. They usually see the vet first when they're a new
Okay.
patient,
Okay.
which is nice because, you know, there are owners, unfortunately, that are just like, oh, my dog's limping, and they think that something's wrong with their leg, and they really have like a giant bone tumor, like it's sad.
Huh.
Or they're, you know, weak, and it's not because like they have a disc in their low back, it's because something is really systemically
Got it.
wrong. So it's been wonderful. So I do it on the weekends. I'm usually there every other Saturday or by appointment.
Okay.
So I have an established client that I'm seeing tonight, and she works every Saturday, but she has 4 dogs that I take care of, so I'm going to see her.
How many times a month do you do this?
It depends.
It's
So I'm
okay,
probably at
based on
Bella Coop
schedule.
like 2 days a month. But if a
Okay.
client needs me, like if I have a client where, you know, they're a dog with a disc injury and they're not weight bearing, like I might be there every other day with them
Got
to
it.
adjust them.
Got
So
it.
we just work it around my human schedules here, and then I fit my animals in between, and yeah.
That's a lot of work.
Yeah. I have a lot of energy. I either channel it appropriately, or there's more knitted things that need to be worn by people that probably don't want to have
Where'd the
them.
knitting come from?
I don't know. My sister talked me into it. We were, there was a Groupon, and she's like, we should go and do this.
Groupon again, and Groupon strikes again.
Yeah, she's like, we should go and do this. I'm like, oh, that's such a grandma thing. But we went, and I love it. And it's neat because it's math. Like it's science and math, and it's like 3-dimensional. And
Is it mindless? Is it an activity while you're thinking about something else, or do you actually concentrate on it?
no, it becomes second nature. So there's a podcast called like Were You Raised by Wolves, and one of their segments is all about whether knitting in public is rude or not. Because I think if you're not a knitter,
just unusual.
you think it's weird. I did this program in Ohio that Goldman Sachs did for like entrepreneurs. The one lady in my class knitted the whole entire time, but her recall was great because it's very meditative.
Interesting.
Yeah, and in the rare instances when I go to church, like there's a handful of people that like knit in church. I know.
I gotta start paying attention.
Yeah, I know that when I'm doing it, as long as it's a repetitive pattern, I can definitely pay way better attention because I'm not thinking about a
Got
million
it.
things. It's centering.
Got it.
Yeah. And it's also a portable craft, so I do it in the car and I do whatever.
It's
but
better than having a fidget spinner. Remember
Yeah,
those things?
yeah.
Kids
Yeah.
are walking around with those things
Yeah,
all day.
it
Same
is.
concept, though, right?
Yeah,
To some
exactly.
degree.
Yeah, absolutely. But I just like to stay busy. So, but I love my animal
so.
things.
Obviously so. I couldn't believe I was watching that. I'm like, I didn't even know it was a thing.
Was it a little red dog?
Yeah.
Yeah, without clothes on.
Yeah.
Okay, yeah, that's my Maya. She's a good dog for videos because she is a certified therapy dog, so she's just like really chill.
Okay.
But we went on our honeymoon. It was funny. My husband and I went on our honeymoon last year to South Africa.
Okay.
And we went to this resort up in Kruger National Park, and it was a really small resort, beautiful. But it was funny because I think the staff team, they have like 8 like little mini houses. So there aren't that many people there at a time. And the staff team is very, very attentive, but they study their clients. So I think they like Google you and Facebook you ahead of time to see what you're doing. So one of
okay.
the things they said to me was, I saw your video with you adjusting the dog. And I was like, that's so funny. You have to like really watch what you put out there.
Is so small.
Because there's videos of me like doing like random dances and just stuff. 'Cause we get silly at work sometimes. But yeah, they saw the dog video. But the most commonly adjusted animal is a horse. So though
How is that possible? The sheer weight alone.
they help you. They help you. And chiropractic is all about angles, precision, angles, speed. And, in horse culture, states where there are like lots of horses, especially horses that do sporting things like endurance rides or barrel racing or just track racing, horses are incredibly huge, but they're
Okay.
incredibly delicate. And inside their hoof, they basically stand on their like middle toe.
Oh, I know that.
I mean, look at how big they are. And they have
Yeah.
these skinny legs and like their toes are down here. And inside the hoof, they're balanced on this tiny little bone.
like
so-
like a ballerina, a horse
They are.
ballerina.
They are. And they're so delicate. And if a horse is out of alignment, it can affect their gait. It can make them lame.
How about that?
And they're really expensive to fix.
Wow.
And if you have a racing horse or a barrel racer, like they need to win. So if a horse is slow, you're not getting your money back. If a horse isn't winning
So it's
races, you're
lucrative.
not getting breeding rights. Like, yeah. And so, it's both, getting your horses adjusted is both a money saver in terms of
Yeah.
vet bills. And if you're using your horse as if your horse is also a source of income for you,
Right.
you need them to be in the very best shape possible. So, but I don't do, I'm trained to do horse work, but I don't do it because it's challenging, right? You have to drive
bet.
to the barn. You have to have a vet on site.
Yeah.
When you're adjusting a horse, you usually need somebody to just basically control their head. So you put the bridle on them and hold them that way. You don't adjust them in the stall because if they get upset and try to,
They kick you.
yeah. So you have to bring them out. You have to make sure that you have an assistant. And usually when you're adjusting horses, you're either on a ladder or they actually make these bales.
Oh my gosh.
That are like these big, they're made out of marine foam and you
Okay.
can stack bales. Because sometimes you're over them, like if you're adjusting their pelvis or their low back, you're over them. Sometimes you're next to them, if you're adjusting their middle back, because you can reach.
Does it require a lot of strength, though? I mean,
not necessarily. They're not any animal and any human being. If you have the vertebra, if you have the bone, if you push it into the direction that it's already out, it's going to be painful or uncomfortable for them and they're going to move away from you. If you push it into the direction that it belongs, even if you lean on it, it's going to feel good and they're going to lean in and help you.
that's why it feels so good to get
Adjusted. Yeah. And so, they actually help you. So yeah, you have to be somewhat physically strong, but it's more about having the right hand contact. You'll see tiny, tiny, tiny women that are awesome adjusters. They're fast and they're really precise. So it's not about brute strength as much as it is how you
Technique.
interact. Yeah, technique. How you interact with the animal. What's your finesse like? Are you on the right spot? And are you reading their signals? Because you actually, you have to work with them and they can't talk. So you can't be hey, Mr. Rottweiler, I'm going to need to work with you today, and you're going to have to let me bend you this way.
Communication's a challenge.
So part of it, it's body language, and it's their trusting you, and it's your confidence and respect to them, and your respect of them and their species, really.
This was awesome.
Sorry.
This was so much fun. This was so much fun.
Talk a lot. Well,
No, I encouraged it.
Yeah. Well,
How can they reach you? How can they reach you?
Oh, yeah. So the best place to find us is at our website, which is www.choicemedpgh.com.
It's easy enough.
Yes.
Choicemedpgh.com.
Yep. Or just Google Choice Restorative Medicine. We're in McIntyre Square next to the Giant Eagle. And you can reach us. Our phone number's on there. We have a place where you can email questions to the doctor. They go right into my inbox. So
Okay.
I'll respond. And you can call us, whatever you need.
Are you available to adjust their dog?
Yes.
If their vet determines it's required. Is that
Yeah.
how- is that
So
how it's done?
if they feel that their dog needs chiropractic, a lot of similar to people, a lot of what we do in our practice is wellness, and especially aging dogs and comfort care and all that other
Okay.
stuff. They actually can either contact me and I can connect them through my website to Bella Coop,
Okay.
or they can just contact Bella Coop Animal Hospital of North Park.
How about
It's
that?
BELACOOP, named after the veterinarians to first dogs.
Google. It's your friend.
Google is your friend. And if you want to look up any of the stuff we talked about today,
Absolutely.
Google. Yeah.
Come back and see me.
Yeah, I appreciate you having me on today. This has
this
been
is
awesome.
awesome.
And now you have to come try out the rack.
I'm going to.
Okay.
Maybe we'll shoot some footage there too. That'll be pretty fun
Yeah.
for your next time here.
Yeah, whatever you
I
like.
appreciate it. Thank you,
Yeah,
Doctor.
thank you, Eric.
All right.